So maybe, coming back to your bio, so you find yourself getting a little bit more skilled up and learning about technological improvements and ways to actually carry out your service a little better. So I guess, how has the advancement in laparoscopic surgical procedures actually improved the service of care at Carringani?
right? So brings us back to again cost of healthcare and how far we were back in technology say 20 years ago. As technology was improving in other countries, the private healthcare system caught on to this thing because they knew that there was this need to grow in
Right,
terms of what the world actually wanted
right.
and not what the government actually wanted. But the government was probably looking at, dollars and cents in terms of, political populist policies where they could actually serve, which is a good thing. But, if one wanted, say, cutting edge technology, you wouldn't want to, you couldn't get it in the public health care system.
Yeah, yeah.
In those days, in 2005, 2006, I'm talking about 20 years ago.
Okay.
So I had the opportunity, of course, to go to Glasgow in 2006, and they had very good equipment. And when I came back and in 2012, the private healthcare sort of like offered me to say like, why don't you come over to our system? So I went over.
Mm-hmm.
But I didn't leave the system completely in the sense that I went over and I said, look, I'm coming to you to provide the service. You give me this equipment that I want, but my heart was still with, the public healthcare system. So I went back.
Okay.
Every day after 5 o'clock, I used to go back and provide free service for the cancer patients in play.
Wow.
I still do it till today. I've got my accreditation till 2024.
Mm.
My credentialing to 2024. So I didn't leave the service, although it was a service because it was a service that I built up, and it was because of I wanted to serve the community which couldn't
That you Yeah.
fed my soldiers, number one, but
Yeah.
they couldn't they couldn't come and afford to see me in the private healthcare system.
Understand.
A lot of them didn't have bus fare, and they came from estates. They used to sleep in the verandas because they can't move back because the bus fare is coming. The bus stations are closed.
Okay.
I'm sure you'll face all these kind of problems in Australia for the rural centers.
Yeah, I mean, similar circumstances where I think physicians would struggle, but it's in Australia, you have this compulsory private health insurance process, so everyone has to have private health insurance. If you don't have private health insurance, you're taxed. When tax time comes, which and they try and do it in such a way where you can have the basic, you just have hospital care, or you have extras and stuff, and it's fairly competitive.
So that's where also what Singapore did, because they took away a bit of your taxes
Correct.
and put it into the healthcare system. But Malaysia didn't want to do that
Yeah.
because they thought that if they could actually sustain a healthcare system with paying healthcare workers a sort of reasonable
Yeah.
amount, and giving the basic facilities, then they would be able to sustain a system. But 20 years down the line, it's coming to a breaking point as well, to a certain extent.
Yeah.
So the private healthcare has right in the middle of that, and because we're going now towards medical tourism, so we're looking at competing with countries like say Vietnam, Thailand, Singapore, Indonesia. We just got
It's interesting you bring up the medical tourism, because I think I remember, this would have been about maybe 8 years ago, when I'd come down to KL as well for another purpose. One of the doctors out there actually was trying to promote medical tourism and trying to get people from Australia to fly in, because people, like you said, people were going to Vietnam, were to Bali, were going to other parts, but didn't consider Malaysia as a country to come in for. So, and I'm not too sure what that is like at the present moment, but I'm assuming it's good. People are
well. Malaysia didn't concentrate too much on health tourism because the local needs were not met yet.
okay.
To a certain level.
Fair
The public hospitals or the private hospitals came out were just concentrating on the local needs.
Yeah.
Then the government could not give to the other people, to the employees of the private corporations. The private healthcare took care.
Yeah.
So only now they're beginning to talk about cancer services. They're talking about fertility services.
Okay.
They're talking about access to immunotherapy, and a lot of countries sort of like approached us and said, look, if you can allow us to have access to your healthcare system, we are willing to pay for it. Colombia, Asia, which is a regional player for India and China,
Yeah.
has come about and bought a lot of funds. So the big conglomerates, the Japanese have come in and bought a lot of our hospitals as well, because they're saying that, look, we know what to do. And a lot of private equity firms from America will come in and say, look, just come in and we'll buy your centers and we'll buy your cardiothoracic services, and you guys for us. You tell you what it's there. So
So is that where the large corporate groups start to occur? And so those solo practitioners kind of disappeared in a way because the corporate groups came into play?
yes. So there's a bad and a good to it. The good to it is that the governance is very good as far as the foreign companies are involved, because they got experience in
Yeah.
these systems in their own country.
Yeah.
So they just extrapolating their work into our in Southeast Asia.
Yeah.
And IHH, International Healthcare Organization, which owns a lot of hospitals in Gleneagles,
Yeah.
Malaysia, India, they bought for a big group of ours called Antai Group and Gleneagles as well. And they've got about, I think, almost 17 to 18 hospitals, either in
Wow.
Malaysian region or the Indonesian region. They provide access to inter-travel between the doctors. I mean, you don't have this particular specialty, we can bring in the same guy from Singapore and things like that. So they're looking at all this, and they're controlling the general practitioners as well. So they're buying up general practitioner clinics. But they say, if you go to this particular clinic, and if this clinic says, look, you better go to this particular hospital. So they sort of like streamlining healthcare towards the system, but that's
Okay.
a very profit oriented.
Yeah. And that's honestly happening even, I think, if I may say, even in Australia, where we saw, the solo practitioner concepts really diminishing. People are getting into that paperless approach, corporate environments.